Welcome to Rebranding Menopause, the girlfriend's guide to everything menopause. We're basically taking you through our personal experiences and guiding you through what works for us, what doesn't work for us. I'm here with my amazing co-hosts, Dana Persico and Sharon Grasso.
Hi, guys.
But today I am so excited because this episode is a little bit personal for me. We have a special guest. Her name is Dr. McNally, and she is from Northwell Health, menopause specialist. She has an office in Garden City and in Lynbrook, and she's here with us today.
Hi, everyone.
Hello.
So glad you're here.
Excited to have you. Same. This is going to be great.
I know. I'm so excited. I just wanted to say quickly that it was a long path for me to get here, to have a doctor like you that I'm so blessed to have a relationship with. But about 15 years ago, I was told I was in perimenopause. And I went to my gynecologist's office, and he sat me down in his office, and he's like, you need to take some extra vitamin D. And I sat there like this. I didn't ask him what perimenopause was. I didn't ask him what I should do. I didn't ask him a thing. I said, thank you. I walked out the door. I buried it and never spoke about it again.
Okay. Denial.
Sounds about right.
Right? Complete denial until menopause just punched me in the face, and I kept on getting the worst brain fog and sweats, and I felt like I had osteoporosis. I felt like I was aging right before my eyes.
The 92-year-old woman invaded your body.
Exactly.
Mm-hmm. Yeah.
And I was sad, and I was really, really upset. So, I know the statistics are that how many women are going through menopause right now?
Oh my gosh. So in the United States, there are 75 million women that are either perimenopausal, menopausal, postmenopausal. And of those 75 million women, we know that there are how many? Only
Well, 6,000 are going through, coming into
daily.
menopause daily, right?
6,000 are added every day to that number that are being diagnosed. But then 30%, which is really not a lot, of that number, which you think about it, I think it's like 2 million, maybe a little over 2 million.
30%
women are actually in treatment, receiving medical care.
Well, 30% are seeking treatment. 16% are actually receiving the treatment. That's just insane to me.
Nothing.
And part of that is the conversation, right? What are we educating our women about? What are we talking about? How are we connecting? And so things like you're doing, just bringing it up to everybody's mindset is exactly the first way to handle it. And we were talking before that the Women's Health Initiative, the study done 3 decades ago, owes us all a very deep and sincere apology. When
Amen.
When they started looking about data, right? Data is important because we want to make sure we're giving you the exact treatments, the right doses, individualized to you. When they started doing this evaluation, they put women that were 50 in the same bucket as a woman that was 75. Mm-hmm. And it's not the same, right? The 90-year-old invading your body, which is okay if you're 90. We love it.
Right.
But the comparison is not the same for cardiovascular health. And so these risks that were the hard stop, don't do this anymore, the black box warning is not fair. So re-looking at the data now from a health perspective, women in their 40s and 50s are not the same. That's a really good time to have that conversation. What is perimenopause? When should I think about hormone therapy?
And back to that study, wasn't it only one woman that was actually diagnosed with cancer when they originally said that HRT is bad for everyone? They just painted with a very broad brush and said no good for anyone.
It was a small percentage, and part of that was even the cardiovascular risk, which your blood vessels, your heart changes from your 50s to your 70s. So it wasn't necessarily the absolute number, but it was a small percentage that was enough that say, wait, we didn't subset the women in this study. Should we stop everybody? Should we relook at this? So you're right. It was a small percentage, but enough that they said no more.
And it was a man that wrote the study.
Let's not go there.
No comment.
But how sad is it that the women that are now in their 70s and 80s, back in the 90s, which it seems like, the 90s was a minute ago. I was young in the 90s, right?
Yeah.
now that they're the age they are, if they had the opportunity or the availability of some of this knowledge, they would be experiencing something very different than what they're going through now, osteoporosis, all the things that could have been avoided if some of this information, these resources, were available to them in the 90s. So we do owe, decades of apologies for that.
Yeah, and I mean, I still think that women that are in their 70s, like Nonna, like my mom, they are still of that mindset, and there's nothing that's changing them. When I told my mom that because I had been taking this, managing my menopause naturally for years until it just couldn't go any further where I needed treatment. And I told my mom that I just started 4 days ago. She was like, oh, I'm so disappointed. Literally, I can't believe it. You can go through this naturally and you can, okay, but I don't want to feel this way anymore.
Why should you have to?
Right. So when I finally found Mondays with McNally on Instagram,
Menopause Mondays with McNally. Yes, I love it.
Exactly. I'm like, she gets it. And I called the office and it was hard to even get to talk to her. Right. So I'm like, I am not giving up. I kept calling.
But you knew then at that moment that this was your person.
I knew. Yeah. The second she told me that she was allowed to say the word vagina, I'm like, we're going to be really good friends.
Yeah. And I think to the point is about connecting with somebody, connecting with who you are there, and being in the world and the space of menopause. There's a separate certification, right? So when women are looking for doctors, looking for providers, it has to be somebody, like you said, that you connect with, that is knowledgeable in the areas. When we talk about menopause, it's head to toe, front to back.
Right.
You could have mood changes, sleep disturbances, you could have vaginal issues, sexual issues, joint issues. Your whole body's affected because in a woman's body, there's an estrogen receptor everywhere. And when there's no estrogen, guess what? Changes happen.
Right.
So it's the suffering in silence that absolutely needs to stop.
Right. Like when I went through my consultation with you, I mean, Dr. McNally asked me everything about my life. It was just, she wanted to know everything.
Which is amazing because it's the whole picture.
It was amazing. And I text her as soon as we got off the telehealth call that I literally broke down crying when I got off the call.
Relief,
because
you said.
Yeah. I was like, oh my gosh, I felt hopeful. I felt hopeful that things were going to change.
And we're going to take a minute. And also, it's not just a person, right? It's finding the person. And I will give so much credit to so many of my colleagues who took that additional certification. Northwell has built an entire team, virtual and in person, right? You need that personal connection for exams, for other pieces. That is unique. And from Peconic to Westchester, we can get you help.
Thank goodness.
Unbelievable. Thank you, Northwell.
Thank you, Northwell.
And to that point, the Katz Institute, how we are building these providers, and it's not just OB/GYN.
Right.
Medicine, cardiology. We talked about your cardiac history.
Right.
What is your lifetime risk of cardiac issues? Is your status something that you are a hard stop no? For those patients that have gone through breast cancer treatment or cancer treatment in general, there's a whole subset of conversations that need to be had. Right. So this is just the beginning of so many things that we can tackle. And if somebody is not listening, we have people that can help.
Right.
And can you talk, I think it's really important, mental health is a huge topic today in so many different venues. So a woman in her 40s, all of the levels start to deplete, right? So if progesterone, which is your stress fighter, I believe, and correct me if I'm wrong, it's kind of like your feel good. It helps you kind of manage how you deal with daily stresses. If your progesterone is going down and down and down, doesn't that affect a woman's mental health? Because they say that in women's 40s, when they are just at the onset of menopause, or maybe they're in menopause, the mental health issues are so exacerbated that there is a very high incidence of attempted suicide, misdiagnosis of mental health issues. And we've heard that from so many women where they've said that my family said I was going crazy and I didn't realize. So is it the progesterone in conjunction with the low estrogen? What does that look like?
It's a complete combination. Why do I say combination? Because our hormones all interact, and from the look of mental health medications, a lot of them have to do with serotonin and dopamine. So your serotonin is a huge component into your mental health piece. And ironically, and I like to think it was a female statistician, Paroxetine is a medication, an SSRI for mental health. Extremely effective, and they polled women who are menopausal. And I also think we are not postmenopausal. What, you're not post-adolescence, you're menopausal.
Right.
Great. Forever.
Forever and
Right.
ever and ever.
You are menopausal.
Can you take hormones forever
Yeah.
and ever?
So it's a conversation to be had and individualized. I had patients in their 70s that never stopped, and they said, I felt good and I wasn't going to stop.
Sure.
So when they looked at women on medications who were menopausal, their hot flash experience was less. And so the company's pharmaceutical created a dose specific just for hot flashes. So Bristol, and I'm not endorsing Bristol over anything else, but this company created a dose specific that was FDA approved for hot flashes non-hormonally. The first.
Non-hormonal.
Non-hormonally. The second prescription medication just came out about a year and a half ago. So we have some catch up to do, but to that point, it is the serotonin, it's the estrogen, it's the progesterone, all connection, and how your testosterone's changing. And with your metabolism, that does change. Your insulin and your sugar ratios also contribute.
So your whole body is changing.
100% changing. And change is inevitable. It doesn't mean that you have to suffer. So it doesn't mean menopause is a bad thing. It's just how you feel. You've got to then tackle that. And the other thing, and we've talked about this too, if you are up all night sweating, you're not sleeping.
Right.
And you are fatigued.
And you're an animal when you wake up.
It affects everything.
Everything. So to your point about progesterone, yeah, that's a huge part of it. But just even in the non-hormonal states where some people are, right, it changes. But in this fertility window for some women, progesterone actually going up in that second half of a cycle can actually make people's mood worse. So the PMS, PMDD, so other changes hormonally that are more exacerbated. So many things we can talk about.
So good for us to know. We're also trying to really target younger women.
Yes.
So that they'll know what you just said is so important. If
they need to
Be
know.
prepared.
And
getting their
husbands
period and feeling those
I'm sorry,
effects,
everyone
yeah.
needs to know this
Right.
because as a mom going through this, I don't want to seem like, ooh, did you talk to mommy today? Ooh.
Yeah.
No, I don't want that.
Correct.
And I don't want my husband to feel like, oh, no, it upsets me when they feel like that.
But your whole
like I said, my
household is affected.
Jack said to me, you're a 5 out of 10. And I said, what does that mean? He goes, well, 5 out of 10 times I enjoy being around you.
Aw,
And I
at
was
least you
like,
got half. At least you got half.
Listen, if that was your batting average, you'd be making millions of dollars.
And my husband's joke is before we go anywhere, if we're going away, the last question is not do you have your license or passport, do you have your cream?
right.
So we get that. Yeah. The family gets so involved in the
family's
whole
affected.
process.
But
yeah.
I think that there is still, hey, listen, I think in the last year we've come a long way. Baby, we really have. I mean, I think just in 2024, leading into 2025. However, it's still the same way with men. We're talking about it, but I don't think men are. Because I'm living in a household with a man and I'm doing a podcast and he still doesn't get it. Not to say there's anything wrong with it. He's just not really understanding a lot of it.
Ingrid, question for you. Do you think that, because we have a whole different, in terms of our hosts. So I have not yet done any hormone replacement. Dana was very proactive as soon as she felt it.
First hot flash, she's in.
And
After a
Ingrid's-
partial hysterectomy, so I kind of knew it was coming. So
But you were very proactive.
yeah,
She
immediate.
wasn't waiting for it. She
Yeah.
wasn't going to suffer in silence. She was going. And Ingrid just starting out, I have not yet started. Do you feel that because the way you were raised, this was not something spoken about?
Right.
Even now, mom frowns upon you
Right.
doing it.
Right.
So do you think starting this podcast and feeling more comfortable around people, bringing it more out into the open, prompted you to be more likely to find
Oh,
a
without a
doctor?
doubt. And it was a search to find her. It's a part-time job. And that's why I think when we talk about the fact that only 16% of women in the United States are actually being managed, having managed care, it's because it's a job to find someone that really understands you and gets it. But yes, this podcast did prompt me because I wanted to find a place, and I want other women who I talk to and I'm so close with that have no idea. And these are my good friends
they don't want to talk about it.
They don't want to talk about it.
They need a community.
It brings us to a really important question that we talked about when we knew that you were coming on, that where is the right place to go look? Because we talk about pellets, we talk about creams, we talk about prescriptions, talk about what you see coming at you on social media. If you've searched menopause once, it's coming up in your feed, and
if
it
you
just
talk
looks
about
like
menopause to your girlfriend, it's coming up.
Yeah,
in your feed.
so there's so much information.
Here's you.
So
Alexa's always
you
listening.
talked about being certified, and we know that is so important. So how does one find someone who is certified by the right platform, the right accrediting body?
Well, what is the right platform? If
Right.
you don't mind me to just segue. What is the certification? What does that look like for a physician in terms of
what did you go
hours?
through?
What did you go through, and what does that mean?
So for trainers, for physicians, for ACPs, because there are some people that are learners, residents, fellows that are going through it, the Menopause Society has an exam. It has additional CMEs, which is continuing medical education courses. They have an annual meeting. So all of these things keep us up to date and keep us connected. So it's an additional test and certification that comes with it. I foresee this becoming its own subfield of medicine in the future. It has to.
As it should be, yeah.
Correct. But today, that's the process. So if somebody globally is looking for a menopause provider, you can actually search up Menopause Society providers, and it will do it based on zip code. For the Northwell team, you can look up menopause and midlife medicine. It's part of the Katz Institute. And then our team will then coordinate a provider for you. And again, we have 40 plus providers, and that's growing from cardiology, from medicine to OBGYN. So to that point, who are these providers? And then there's additional areas that we can supplement. I'm working on a manuscript right now to look at acupuncture. And we had talked about what things can help.
I just started that too,
right,
acupuncture.
For a complementary integrated approach. So when you're looking at what do you need to do in that perimenopausal period, first it's level set. This is how I feel. And when we were talking before, so get out your pens and papers, the Menopause Quick 6. You can Google it. A doctor is telling you to Dr. Google something. It's totally okay. It is 6 questions that you can be empowered to see your doctor. It talks about your mental health. And one good thing that now in January, every medical office should be screening for mental health.
I've noticed that, and I think that's incredible. I think that's so important. I noticed when I went for my annual physical, they had a whole section about mental health. I think that's great.
Correct.
Yeah, my doctor asked me if there were any guns in the house during a
you had
screening.
said that,
Remember
right?
that? That was so weird.
But it's good.
And part of it is about safety. It's about that community, global health perspective, because it's not just a prescription for your blood work.
Right.
And so when you're looking at it, you go into the office, you talk about your pelvic health, your mental health, your cardiovascular risk, other pieces that are related to not only women's health in the Quick 6, but also your overall health. And then your cancer risks, right? For those women that are a higher risk, if you have a genetic predisposition, how do we then tailor your treatment? And I hate to even say treatment. How do you
manage
tailor
it?
your lifestyle?
Your life,
Right. It's just
You're
like
managing
anything
the rest
else.
of your life.
It's
Right.
an individualized plan.
Correct. And that's the most important thing, that any podcast, any webinar, anything that you join is going to give you an overview. But you've got to sit down and get into the nitty gritty of what is happening to you.
Right.
And things change. So having that connection is really important.
So that brings the question to mind of pellets are FDA approved?
They are not.
Thank you. Many people have asked us. So they've been created by a pharmaceutical company. They are being offered everywhere.
Wait, pellets are not FDA approved?
They're not regulated or approved at this time.
And I found that
Provider.
out from one of our girlfriends.
Imagine you stick
who
that
was-
in your ass and now you're stuck with it.
Well,
Well-
they're actually implanting it. And,
Yeah.
and when you see, I'm sorry to interrupt you, as an aesthetic provider being in that arena, I'm seeing how many Botox, come get your Botox, your filler, and your pellets. And I'm like, well, where's it?
Come get it all.
Who told
I
you
tried
what
the
your
pellets. I
pellets
didn't
and
like
your
the way that I
Botox
felt.
at
I
one
mean, that's
shot.
interesting.
I felt that it was there was no way for the doctor to control once they were implanted,
Right.
if that's the right terminology.
Yes.
And I had to wait until the effects wore off, but did not like the way that I felt. And then we happen to have a girlfriend
stuck.
who is she's a medical doctor, but she's in the field of forensics. And I had gone out to lunch with her and told her, we were talking about menopause, and she said, she sees people that are postmortem.
She sees dead people.
Yeah, and she's really good with them. And she said,
Every pun intended.
I'm really concerned about you having pellets. And she said, it's a whole nother conversation, but I see things from a very different perspective.
She does. She's the most interesting
so incredible.
person in the world.
And she said, do me a favor. She said, just think twice. So I made a personal decision not to move forward with a second treatment of them. But getting back to pellets, not FDA approved. Hormone replacement therapy creams, which are, they say they're like based, they're formulated or compounded. Are they regulated, or what is the regulatory process? Because the testosterone is a controlled substance.
Correct.
Okay, so what about the rest of it?
All right, so there's so many layers to this, and I want to give a general quick overview because we could talk about this for hours. When it comes to bioidentical, that means you're taking something that's very similar to what your ovaries or other organs made. Estradiol is really that primary hormone made by the ovaries, and anything that you're getting with estradiol is that bioidentical. Compounded is different, where the pharmacist or some other company is making it, but it doesn't have that same connection to a bigger pharmaceutical brand because it's being done more locally. They should be tracking dose and formulation. So compounded versus bioidentical is a little bit different in what that means. But in general, a lot of the prescription estrogen creams, topicals, pills can be bioidentical and prescribed. And then there's a whole other layer of Premarin, which comes from horse pee.
Yeah.
And that's another, and that was actually what was used in those women's health initiative studies from
Years
the
ago.
past.
Yeah.
So again, a lot of nuances in terms of what's used and what's prescribed. But what we tend to do now is start low, titrate up, and start early. So the timing of hormone therapy, and that's where you can tell your mom, I got you.
Right.
Because starting it earlier and closer to that menopausal transition will actually probably be healthier for you.
Right. Well, guys, on that note, we're just going to take a quick break to have a word from our sponsor.
Hey New York, I'm Harvey, proud owner of Optics and veteran in the eyewear industry. Consider this, why would someone have a closet full of shoes but only a few pair of glasses when eyewear is the only accessory that completely changes the way you look, feel, and the way you're perceived? At Optics, Cartier, Chanel, Dior, Lindbergh headline our extensive collection of luxury eyewear. Our opticians are trained to style and fit your face to ensure that when you leave Optics, your friends will be wondering where you shop.
I'm coming back in with some Once Upon a Coconut. Did you guys try this?
It's so good.
It's actually really good.
It is.
Really
Now that
good.
I'm not drinking, I think this might be something that I'll just
And this is really good
have
for
on a Friday
Manjaro
night.
maintenance because you know,
Very hydrating.
yeah, you need to be hydrated when you're on one of those.
You know what? Talking about, dry January, which I'm in right now.
I thought you were going to say dry
Which
vagina.
dry January?
We can talk about that as well.
You know what?
I
Let's talk
said
about
vagina.
that. Let's talk about that. Let's talk about the dry vagina.
Okay. So lack of estrogen or depletion of estrogen, because we're still making some. And that's why you have the menobelly, right? Because your body redistributes where certain types of estrogen are made. And what happens is the vagina has multiple layers. And the top layer, where you get hydration, has lactobacillus. And the lactobacillus sitting on the top of the vagina, right, like yeast, keeps moisture in place. So when the estrogen decreases, that change in the pH happens, less ability to hold hydration, and things become thinner. So when you're looking about dry vagina, it's really important to think about hydration as well as potentially some estrogen supplementation. And that's what we were talking about, the estradiol.
That's where the coconut water comes into
you
play.
just put some coconut water down there?
I'm to be launched.
Not encouraging to put the coconuts in the vagina.
No.
Yeah, that's a whole that's a
Different
fetish.
sex
That's some fetish
conversation.
stuff.
Now you have
Come on.
splinters.
Is there something, and I want to go back to that, I'm sorry. Is there something for someone that may not be on hormone replacement, or that is a topical thing for that to kind of moisturize and make sex more comfortable?
Hyaluronic acid used anywhere from 1 to 3 times a week is incredibly effective. It's great if you look at your face lotions, it's there. It's for your hand lotions. It's incredibly effective.
Wait, so the hyaluronic acid you just
Your
get
body
from
produces.
So we can take the face and we can kind of just do a
It's
full
very
body.
safe.
There's a specific
I'm
one
just
for the
asking,
vaginal
multi-purpose.
area.
Oh, okay.
And
Specific.
Correct. And you can
Yes,
insert
I
it like a
have one. Someone-
suppository.
Someone gave me, by a skincare company, a product line that we carry, somebody actually gave me, and I was like, I'm not trying this. I don't need this. And then one day I was just like, I'm going to try this, just
Yes.
to try it. It felt really good. It was a really moisturizing, almost like hand lotion, but for there.
Correct.
And it felt good and it felt smooth. And I have to really double check the ingredients. Yeah.
So it's probably that. And then when somebody is intimate, a silicone water-based lubricant sometimes is better because the silicone can hold the moisture longer.
I'm a big fan.
Love
Big
it.
fan.
Big fan.
Big fan.
Silicone.
Love it.
Got to be silicone based.
And then on top of
Huge,
that,
huge fan.
if
And the huger it is, the bigger fan you are of the silicone. Sorry.
I think I may be getting a hot flash right now. The other piece to that too is that if you do not want to have hormones, physical therapy, vaginal dilators, all done in connection with a medical professional can really be very helpful.
Wait,
What do you
physical
think
therapy
about-
for your vagina?
Yes.
What does that look like? And
What does that? What
and
does
ha-
that look like?
What does that look like? And that was part 2. These devices that are put out that they're using, and I'm not going to get into the company names
Sure.
and so forth, but that do like a resurfacing
okay.
inside and things like that. How do we feel about those? So it's kind of like a 2-part.
All right, I'm going to add a third part. So let's start at the front. So vibratory stimulation to the clitoris actually brings blood flow and can help with sexual experience. I don't like to say sexual dysfunction because
Right.
we can make things more
So
enjoyable.
Masturbate
Right.
more.
Correct.
So more vibrators.
And there is an FDA approved tool. Again, we're going to stay away from names that you can talk to your provider about.
But we
that
will
you-
get a link eventually and post it.
Okay.
Just go on my Instagram.
So enhancement to the clitoris and vibration can bring blood flow, masturbation, more foreplay with your partner can help. When we work our way into the vaginal area, some of those laser treatments, they're not showing any statistical benefit, and there could be more concern sometimes with burning. So this rejuvenation, for some women, it
Like
works
an
great.
embolization, right? That's the first thing I think of when I hear that, you're doing anything to the lining, right? Your skin is already thin. And so it sounds like it's a little
Well,
risky.
I don't know that it doesn't bring in more collagen, the healing. I'm just wondering if there's actually a benefit.
There's not been one that's been proven
No study yet. Okay.
that
Thank you
shows
for clearing that up.
that it makes a
That's
difference.
a big, in the
Yeah.
world of aesthetics and
Wow.
devices, that's a big,
So again, medical benefits versus what is approved. For some women, they say it's changed their life. So I
Yes.
never want to discount any of you for getting what you need. But in terms of data and benefits, it's not recommended.
Right.
okay.
And then when we talk about just kind of that vaginal change and that vaginal health, pelvic floor therapy, right? So it, like any therapy, you hurt your shoulder, you're going to go to physical therapy. It is the muscle, the connective tissue, and it changes in menopause. So as the estrogen levels decline, the vaginal tissue becomes sandpaper, the muscles become weaker, and that's everything in your pelvis, from your bladder to your rectum.
Right.
And so physical therapy will work on core exercises to help strengthen. They will show trigger points because even though you think things are weaker, some areas become more tight because the lack of estrogen pulls the skin tighter and the muscles tighter. So you may have some areas that are moving south and other areas that are pulling tighter, and it really is incredibly effective.
So Kegels don't really help. They're not enough.
Kegels help, but they may not be enough. And that's exactly beautifully said. It is about strengthening the pelvis, but there's a lot of things in the pelvis, right, that you don't think about.
Well, what about urinary incontinence? So that's one of the things touted by the devices that are used, that they can help with urinary incontinence. Is that also absolutely not true?
It's going to be individualized, and the data doesn't support that as the best treatment plan.
But does the data support that HRT can create a benefit for that?
I love how you're thinking. Localized hormone has helped with decrease in urinary tract infections especially, and for building up the tissue.
Right.
Because if the tissue's thinner, the bacteria finds a way to get in there.
I have a question that's, it's not off topic at all, but it's a little bit different. So again, in the arena that I'm in, which is the world of aesthetics and, skin, and it's all skin, right? So labiaplasty, there are so many people as they get older, even younger girls, that are really opting for that. It's becoming more of a thing. But it raises the question for me, because that entire area helps to lubricate, including the skin that's cut off. Do you see any loss of, or more dryness or lack of lubrication, or the ability to lubricate when they're excising the labia or part of them?
That's such a great point in terms of how you feel, right? You have to be comfortable. So if you're not comfortable in your skin, then your whole sexual experience, which is so tied to your emotional wellness, may be affected already. Right. So in general, I don't see an association with how much is removed versus their lubrication.
I agree with that 1,000%. Because if you feel like things are changing on your body, let's say even if it's your breasts or your vagina doesn't look the same, like it's all mental. It all screws with you mentally when it comes to
it's our confidence.
Your confidence. So it's all tied together.
Yeah. I mean, these are all questions that I get, and it's so important to get the real information.
Sure.
So thank you.
And to get the right doctor. Oh my God, as you were even talking about that, I'm thinking of all the things that could go wrong with seeing someone who is offering that service but doesn't necessarily have the right level of training. That could, so many things could go wrong. So the resources that we're trying to get out to all of the people that are watching the podcast, that are talking to their friends, our information has to be so incredibly vetted.
Right.
You need to, in this arena, when you're seeking anything out that is related to the issues that we've been discussing, you have to vet and go to the right resource.
Exactly. I mean, our whole podcast is based on the girlfriends' discussion, right? We are not medical doctors. Anything that we say or that we're doing personally, we're not recommending to anyone. Right. You're a doctor, so that's completely different. Your insight is invaluable to us. But
and your affiliations, you know, when you look at Northwell and, you think, who are leaders? You need to go to the leader.
Right.
And you're going to Google, right? We said menopause and things like that. So let's kind of just go back to the pelvis. And I'm so proud of how we've invested in women's health, particularly in the South Shore. So
wait, so you're talking Northwell?
We're talking Northwell, we're talking Katz, we're talking women's health. Right. And just down the street on Lincoln Avenue, we just opened a pelvic and breast center. So what is going to be there? Everything we're talking about. Urology, urogyn, GYN, vulvar pain, pelvic floor therapy, GI, colorectal, breast benign, breast cancer. New York,
people.
For women. Incredible.
Thank you, Northwell.
So that is opened. It is launched. Our ribbon cutting is coming up. Why do I bring that up?
To be there.
I think we might have to be there.
When is that?
All of our key pelvic elements put in one place so that a woman can get everything she needs. And some of those procedures, if you need something, you may need different disciplines to be present.
Sure.
Right? The younger community in terms of endometriosis and fibroids. Guess what? These are real issues too.
Yes.
And that's the prep for menopause. How do you care for yourself now and in the future?
Early.
Yes.
Start early.
Education is everything. Yes.
And we will be talking about that on our next episode. We're going to wrap this one up, but we are going to come back with Mondays with McNally, aren't we?
I certainly hope so. I have so much I cannot wait to talk to you guys about.
This is so great. Thank
Why
you
is it
so
ending?
much.
Don't let it stop.
No, it's Monday. It's
More
not
to be
ending.
continued.
It's not ending. It's to be continued.
Love
Be
it.
continued.
So we're wrapping up right now, and we'll see you next time. If you're here right now, hit the subscribe button, and we'll see you soon.
Hi friends, this is Dana Persico from Long Island Nail, Skin and Hair Institute. The Institute is not only the premier venue for licensing and certification for beauty professionals in Long Island as well as New York State. You can receive beauty treatments specifically for anti-aging, facials, body treatments, laser hair removal, hydrofacial. Our senior students are working in the spa. They are happy to get any of our guests ready for their special event located in Bethpage, New York at 1055 Stewart Avenue.